Uh, we are live on all the channels. Everyone, strap in. We got a great one today. I know I was energized just seeing this on my calendar. Always good to reconnect with my good friend, Dr. Kwadwo. And we want to talk about his new book, Prevention Over Prescription. So go make sure you go pick that up now, all the usual places. Dr. Quad, great to be back with you, my man. Tell the good
Phil,
people what you've been up to.
Phil, number one, as always, this is a pleasure. This is a privilege. Really appreciate you having me on. And yeah, you and I have been on the same mission. I feel like there's very few people with our credentials that could speak to the importance of preventative health. And you, with the amazing book, Stay Off My Table, it was a real motivator for me too to create this book, Prevention Over Prescription, and really leaning in on how we avoid seeing someone like myself or yourself in the hospital setting. So we leverage 5 pillars that we talked about: finding your purpose, nutrition, exercise, recovery or sleep or stress management, and connecting and social connection, and the importance of these things. And as we may talk about, Phil, I always say you only need to focus on 1 or 2 things that to really make a difference in someone's life. And so that's why we were really keen on getting the book out, and luckily we've been privileged that it seems to be well received. It's been #1 bestseller in a couple categories, so it's been really exciting.
Yeah, great to hear that. And I want to get into, for people that aren't familiar with your background, we're going to talk a little bit about that. Before we do that, just as a reminder to everyone, if you have any comments, you have any questions, you can drop them in the chat on whatever channels you're watching us on, X, YouTube, or LinkedIn. And we'll try and get to some of those questions and comments as we go through. So, why don't you talk a little bit about your background? Like you said, you, like me, are in the trenches, in the hospitals. We're seeing, some things going on that perhaps we weren't too happy about, that led us to start looking for better ways to help our patients. Talk a little bit about what got you to this point.
Yeah, I'll give the abbreviated version, Phil. We saw a lot of inequities and inefficiency in the healthcare system, so it got me to set up this program called Resource Optimization Network, a multidisciplinary team looking at how we save healthcare dollars and improve efficiency and improve care. And we produced these papers, and I thought being a researcher was going to be a way of creating change. And really, I didn't see any change as a result. And then the pandemic hit, and we saw so many people land in hospital, get sick, end up on ventilators, and die related to metabolic syndrome. Metabolic syndrome being pre-diabetes or diabetes, obesity, high blood pressure, high cholesterol. The syndrome that clearly was a main driver of poor outcomes within that pandemic. And as an intensivist, you didn't want to see people suffer this way. They died alone. They were fearful. They'd gone through a lot, their patients and their families. So you're telling yourself, what can we do to prevent such awfulness from happening? And then we have a podcast now called Prevention Over Prescription as well. And you start learning about metabolic syndrome. And unlike anything we learned about in medical school, you find out this stuff is reversible. And I had like legit no clue that we could reverse type 2 diabetes. I was of the mindset that once you start on this path, you are going to lead to be reliant on insulin and escalating doses of insulin. Then you meet folks like yourself, some other thought leaders when it comes to preventative health. And I was like, wow, we need to lean into this, guys. This is 2020. We got all these sick people coming in. Like we have a clear signal that getting metabolically healthy will improve your outcomes, and we could do this by focusing on diet and exercise and so forth. So I was super passionate about that. And then when you look at the economic side of things, one COVID admission in my country in an ICU cost about $53,000 Canadian. And then you talk about the suffering and all the pain and the death associated with those COVID admissions. And then you tell yourself, what if you could actually prevent this stuff from happening if we got healthier. And if we invested even a little bit of that 53,000 into prevention, think about the magic that could happen. And so I was so motivated. And then you talk about the other diseases, like we're just talking about infection, but then you talk about cancer risk, stroke, heart attack. We're talking mental health now with the amazing work of Chris Palmer and colleagues. You talk about reproductive health with PCOS and so forth. Like all this stuff gets better when we focus on our health and we focus on prevention. So to me, as someone that looks at what gives us the biggest bang for our resources, what is going to move the needle, what is the most the 80-20 of health and wellness, it's to get healthy now, to do this now, today. And so was that huge shift for me. So everyone's like, you're an ICU doc, you're going to talk your way out of business. I'm like, good. I don't want to see you land in an ICU. I don't want you to see you on them coming on your table. We're not short on business, folks. So that was the genesis of where I'm at today. And man, I've never been motivated more than I have been now.
Yeah, it's always so just amazing to find colleagues like yourself who are on the same mission, right? We don't want more sick people to take care of. We're overwhelmed taking care of sick people, and we want to get people to start understanding the power of prevention, right? And keeping them out of our ICU, keeping them off the operating table, whatever it may be. And in the book you go through all the different systems, right? Like you were just talking about, this isn't only about heart disease. It's not only about diabetes. It's about mental health. It's about reproductive health. And it really touches every aspect of medicine and of humans' lives, right? Of people's lives that we can impact with this. You talk about, you just mentioned the 80-20, right? The Pareto principle. Talk about how that plays a role. It's one of the chapters in the book. How you use that as you're laying out the framework for people to be improving their health.
Oh, thanks for highlighting that, Phil. It comes down to a simple premise where we, first of all, get inundated with health and wellness information. It is relentless. You go on your Instagram feed or YouTube shorts, and you're going to see the need to cold plunge, vegan diet, carnivore, you dip your toe in an ultraviolet sauna. Like it's just so much out there. And for me, what is becoming, what I think most people need is, what is going to be the one or two levers that are going to make the biggest influence in your health and wellness. So Pareto's principle is the 80-20 rule. So 20% of the activities you do will produce 80% of the output. So for example, Pareto was an economist. And when you look at if you're a business person, 20% of your clients produce 80% of your revenue. So the whole argument is to focus on those 20% of those clients. Don't waste your time on the other 80%. And so the mindset is twofold. When it comes to whether it's your nutrition, whether it's exercise, whether it's stress management, whether it's uh, connection. What is the 20% of the activities you do that's going to give you the biggest bang for your buck? And at a high level, I always say, like, to me, nutrition is going to be the most important for most people, for almost all people, when it comes to improving their health. And that's a small example. We could get into some of the levers within that, but that's an example. And then the other kind of secondary look at 80/20 is that I wholeheartedly believe that if you do the right things 80% of the time, if you're being consistent mostly, you're still going to achieve your goals. Because I think one of the things I see too many people do when it comes to their health is they have this plan. And the second they deviate from the plan is when they quit. When they say, "Oh man, I had that bag of chips on Wednesday with Trudy out for when we went out for wings, and now it's ruining my whole diet. Now I'm gonna go back to where I once was." Like, that mindset's got to change. I really think people got to have that idea of consistency. You're allowed to falter. You're allowed to deviate once in a while, but if you're doing the right things most of the time, it's going to pay off. And so that's basically the two ways I look at 80/20.
Yeah, I certainly agree, right? This isn't about being perfect. And, in a lot of ways, right, the plan that you're setting out has to expect, challenges, right? Expect those difficult situations and figure out how it works around those. I always think back to Mike Tyson, right? And he said, everyone has a plan until you get punched in the face, right? And then you got to figure out, okay, how do I adjust to this now? And that's really what this health journey is about. I think you and I, both having had some personal, experience around this, and then working with patients and seeing what they go through, right? No one's going to be perfect. People are still, you know, going to have their challenges. They're going to have their times when they falter. But the point of all this is you get back up and you get back at it, and you figure out, what's really the important stuff to help you make it through. What is one key principle that you would maybe put near the top of just about everyone's plan when it comes to improving their health?
Great question. So to me, the meta of 80/20 on 80/20 of 80/20 to me is going to be protein intake. I think this is the number one lever that most of us aren't leveraging. We're not optimizing our protein intake. Most people have no idea the power of protein intake. And most people don't realize that if you just do this one thing, something's going to improve. And so the reason I focus on protein, number one, uh, once again, most people don't have enough. So most of us should be aiming for zero point 0.7 to 1 gram per ideal body weight. So zero point 0.7 to 1 for me as a 200-pound gentleman would be around 140 to 200 grams of protein per day, which is not easy to get to. But when you do get to that, you're going to feel fuller. So you're making better food choices. You'll find your energy is better. You're less likely to point towards ultra processed foods or foods that aren't meeting your macro needs. Second, you are going to increase your lean muscle mass. You're going to have bigger muscles, and as a result, you're going to have increasing your basal metabolic rate. You'll burn more calories because you have more meat on you. Third thing is, when you eat protein, one of the magic is the thermic effect. So it takes a lot of work to break down protein. So about 15% of the calories you ingest are going to be used to just digest. So if you've got, Phil, of all people, you understand this as a carnivore, that you get those meat sweats every once in a while, and that's your body trying to break down that protein and that meat. And so that's another magic of focusing on protein. If you're pre-diabetic or diabetic, your blood sugar regulation is going to be better as a result of focusing on protein. So to me, if most of us, which I think aren't meeting our protein needs, focus on that, something's going to pivot. Something's going to pivot in your life. So anyone that follows me on social media, they'll find they're sick of hearing about it. Oh, Dr. K is talking about amping up that protein, get that lean muscle. But I'm saying it because it makes a difference. And it takes, I forget what the marketers say, like 7 or 8 times before something registers. So I'm gonna keep saying it, Phil. I'm gonna keep saying it because this is magical. Focus on protein, magic happens.
Yeah, I agree. I think it's one of those sort of first principles that leads us to an answer that's going to work for most people. We have some great questions and comments coming in. I just want to hit maybe on a couple of them. We got the carnivore violin learner. Love that handle. Looks like she's with us over on YouTube, asking, will a carnivore diet and regular intermittent fasting slowly reduce the amount of blockages in my arteries? And she said that she had had a heart attack due to a seizure, it sounds like. How would you answer that typically for someone?
Yeah, I'll just be like on the defensive a bit and saying like obviously you're going to check with your family doctor, your healthcare provider, especially if you've had some blockages in the past. And a lot of this, what I'm about to say, I've learned from yourself in terms of the benefits of the carnivore diet. I personally believe that avoiding the ultra processed food is probably one of the most important levers for eating clean and having like uh, dynamic and improved metabolic markers. So I've I've seen personally some people get some massive benefits from going carnivore, and so I think it's in the realm of possibilities that by avoiding the processed foods, by having better blood sugar regulation, that the stuff that you're doing like carnivore diet and intermittent fasting could reduce those blockages to a certain degree. Um, I also want to give the caveat too. I personally think with intermittent fasting, it depends how you do it. Like I find that some people don't always get as much bang for your buck, and I'm interested to hear what Phil has to say. But I feel like if you're doing a lot of prolonged fast, if you're stimulating that cortisol response, so that stress response, I don't think you're going to get as much benefit from fasting as some others might be benefiting. And so I don't prescribe it necessarily for everybody and saying this is going to be the magic sauce for everybody. But there are many of you out there that will be fasting and will get massive benefit. So, like anything, there's a bit of nuance to it, but in the realm of possibility, this approach, in my opinion, could improve your cardiovascular health. What do you
Yeah,
think, Phil?
I'd certainly tell people, right, that first and foremost, we want to stop things from getting worse, even if maybe we can't undo some of the damage that's already been done, and addressing the underlying factors that are driving, in this case, heart disease, right? That's the first step in stopping it from getting worse and trying to get it to reverse. If nothing else, right, I always also tell people improving your metabolic health is going to make your body uh, more resilient, right? Better able to deal with these challenges when they come up. You and I see it all the time, right? The people that end up real sick from, let's say it's something like COVID, right? There were plenty of people who got COVID and it was, nothing serious for them and they recovered quickly. And there were other people that got very, very sick from it and died from it. And we knew early on, what the major factor was there, right? The metabolically healthy were able to tolerate this virus, right? This insult to their system. Whereas the people who were already behind the eight ball because they weren't metabolically healthy and they were already dealing with these, the inflammation and the insulin resistance and the diabetes that comes with it, those are the people that got overwhelmed ultimately by COVID. And that goes for a lot of different things in medicine. By the way, just to point out again, fasting, something that you cover in the book. So it really is, what I loved about the book, right, is it's relatively quick read, right? It's simple, but it does touch on the major principles that people need to understand, and gave a good outline that anyone can get started on improving their metabolic health. We have some other questions coming in about, and again, we're not going to give specific advice here, but Deborah is talking about, that she's a 74-year-old female, carnivore, 4 months. She's lost 30 pounds. Amazing. And she's having a typical kind of thing where her doctor may not understand that, and is worried about some of the things that she's doing. What kind of advice do you usually give people on how to talk with their doctors about this, and how to work with their doctors when they're doing something that maybe their doctor just, a lot of times, quite frankly, isn't familiar with, right? The doctor has these misconceptions about what, carnivore, keto, low carb is and what it isn't.
This is a great question, because I think this is good. This is a major challenge, especially in a an environment right now where attitudes are changing. People are taking more ownership of their health. They're recognizing there's different approaches, especially through diet, that will benefit their health that is not classically taught in medical school. So my advice, number one, is always trust your gut. Always trust your instinct in terms of what's working for you. Listen to your body. When it comes to these conversations specifically, if you have anything that you could reference the doctor to, that's always helpful. If there's a study to cite, or a resource for that clinician to learn more, if they're willing to learn more. But you're I hate to say it, but you're often going to run against that level of resistance, and sometimes you're going to have to dig your heels. Sometimes it might mean finding a clinician that is open, and like I'll give you an example of a sign that your physician, like, you want an open mind clinician. You don't want somebody that is absolute about anything. There's times where, even as an ICU doc, there'll be patients that come in and say they want to try something. And I look at it and I say, by the best evidence that I have in front of me, this medication either uh, is shown, for example, shown not to be of benefit. But if I'm confident it's not going to harm the patient and they want to try it, and they're still willing to try the things that I think are important, I'm not going to close the door. I'm not going to say absolutely not. Like, if anything I've learned in the last few years is that we don't know what we don't know. Like, we can't be so absolute with everything that we're saying. So I would just say, often, if your clinician is not being open-minded, it's a bit of a red flag, in my opinion. Like, there's some things within medicine that, yeah, you're absolutely got to be, there's a line that you're saying, like, that's not a good idea. Um, but when it comes to different dietary approaches, when it comes to different supplements, like, I think people just need to be open-minded, and I hope you could find clinicians that are doing that. And if you can't, sometimes it's worth looking for one that is open-minded.
Yeah, definitely. So putting a little effort and changing physicians sometimes is the right answer. As we wrap up here, shout out One Day Soon over on YouTube said, prevention over prescription. Love this. Gives me words to help explain why. So true and so powerful. So why don't you let people know where they can find the book, where they can connect with you, keep up with all the amazing work that you're doing?
So first of all, once again, Phil, this is really, I feel real privileged to be in your space. I'm seeing you blow up. I'm seeing your message elevate, and and it's making a difference out in the world. I, I gotta say, like, it's contagious when you see someone like yourself getting the word out there and affecting so many people's lives. Like when you operate on someone, obviously that's important and you're affecting that life in front of you. But when you're getting a message out like this, like the people listening out there, it's, it reaches so many people. It reaches so many lives, and that to me is so powerful. This is why we do what we do. But in terms of where you find a book, you can find it on Amazon. Look up Prevention Over Prescription. You can go to our website too. It has all our resources, drkwadwo.ca. So drkwadwo.ca, and we have free resources on there too. Like a big thing for me is like for people to get. I want the book in as many hands as possible. So we actually give the book out for the PDF for free when you sign up for our resources. Um, Podcast is Prevention Over Prescription, wherever you listen to podcasts. We're big on social media, trying to keep up with Dr. Phil Ovadia here. So at Quadcast, KWADCAST, we're on Instagram, Facebook, YouTube, Instagram, I said already, X. LinkedIn, and we also got one last thing. We also started a supplement line, guided nutrition, for this reason of being able to provide high quality protein for those that are underdosing their protein. So those are all the things. But if you go to drkwadwo.ca, it's all found on one spot.
Amazing. Keep up the great work. A little preview. We'll be having another episode with Kwadwo coming out on the Stay Off My Operating Table podcast. We just recorded that recently. Be coming out soon as well. We go into a little bit more discussion about all of this, but great connecting with you. Everyone, please, whichever channels you're on, hit the like, hit the subscribe button. We've been doing these live streams a couple of times a week now. My team and I, really, diverse set of topics and stuff that we're touching on, talking with a lot of the thought leaders in the space, a lot of success stories that we've been able to get out there. So it's been really exciting work. And if anyone wants to find out more about what my team and I are up to, you can always go to ifixhearts.com, hit the talk button, setting up an appointment to talk with one of my team members about how we might be able to help you in your health journey. So thank you, everyone, for taking some time out of your busy days, evenings, mornings, wherever you might be in the world. And we look forward to talking again soon.